All right, in this video, we're going to talk about the changes that happen to mom when she's pregnant. Okay, and so we're going to do this, I'm going to try and do this like concept map-ish. Okay, so we've got a lot of different systems here. So we'll just start off with the cardiovascular system. So we're going to make that red because it's the cardiovascular system, right? So you've got the cardiovascular system. Okay, so what are some changes that happen to the cardiovascular system? Well, there is increased cardiac output, and this is because we need to, or mom needs to account for the fact she is delivering more blood because she's got a developing fetus in her. Okay, but what also hopefully happens is that mean arterial pressure remains relatively the same. And in order for that to occur, if we've got high cardiac output, what needs to happen is that total peripheral resistance needs to be decreased. And this occurs due to vasodilation. Okay? And so together, these two things will lead to, we're going to say constant, if not maybe a slight decrease in mean arterial pressure. Okay? All right. Let's talk about the respiratory system here. Okay, and we're going to tie things together here in just a minute. So we've got the respiratory system. Okay. Well, mom starts to increase ventilation. Okay. Why? I believe one of the reasons is to help get more oxygen into her body because she needs to supply oxygen not only to her, but to her developing fetus. And so this increased ventilation, and this is actually hyperventilation, is going to lead to an increase in oxygen as well as a decrease in CO2. Okay? What's this decrease in CO2 do? Well, this leads to respiratory alkalosis. Okay? And we're going to come to that in just a little bit. All right. So, just because P is yellow, let's talk about the urinary system. All right? So the urinary system, okay, well, what happens? Well, GFR is increased. Why is GFR increased? Because of this vasodilation, okay? That's going to increase GFR. What does that do? Well, that's going to lead to an increase in urine volume. If you have high GFR, you're going to have high urine volume. What's also true is that this respiratory alkalosis is going to lead to increased urine volume because what we want to do in this case is if someone is alkalotic, we need to get rid of bicarb. So this increase in urine volume allows mom to excrete bicarb to try and compensate for this respiratory alkalosis. Okay? So this is actually kind of a negative feedback loop here. All right. What else is going on? Well, we've got the cardio, we've got respiratory, we've got urinary. Okay. It goes without saying that the reproductive system, and really I'm going to put reproductive and endocrine because they're really closely related. Okay. So we're going to put these together. Actually, we're not. We're going to separate them out here. So we're going to go with our reproductive system here. Okay, and so what happens to mom? What are some of the physiological changes? Well, one of those things is that increase in breast size. Okay, so this is prepping for milk production. Okay, and we're going to talk about that more on the next video for milk production. Okay, the other thing is there's other things that are going on to basically maintain the uterus. Okay, and this ties into the endocrine system, right? And so with the endocrine system, there's a release of a lot of hormones, right? And we're just going to focus on, or I'm just going to mention two. So we've got progesterone, and we've got, I'm going to do it in a different color, actually. We're going to do it in this purple, as well as an increase in estrogen. Okay, and you're going to see why here in just a second. And then the last one, the one that I almost forgot about here, is the digestive system. Okay. Now, there are other changes that occur with other systems, but these are the ones that we focused on. Okay. So with the digestive system, what happens? Well, motility slows down. So the digestive system, so we have a decrease in motility, which means the speed with which things move. And this is good because what does it do? It allows for increased nutrient absorption. That says absorption, as well as increased water reabsorption. Okay, or absorption, I guess we should say. I don't think I spelled that right, but reabsorption. Okay, we're going to make it so it says absorption. There we go. So we've got increased nutrient and water absorption. There's a problem, though. Or not a problem. Well, maybe it's a problem. This leads to constipation. Super fun. Okay? Because if you're pulling the water out, everything's moving slower, and it's just going to be a lot harder to defecate, right? Not a fun thing to think about, but that's the case. But what's also interesting is that by increasing the amount of water, you're going to increase GFR, okay? And the other thing that will happen, and again, like I said, this is going to get a little messy, is this will actually lead to an increase in mean arterial pressure. If you're pulling more water into your bloodstream, it's going to increase it. So that's why this resistance over here, decreasing that resistance, is so important because it's going to help counteract the increase in pressure that would come from cardiac output, as well as the increase in pressure that would come from adding more water into the system. All right, but this is where it's going to get kind of I guess the most messy here. And all of a sudden my thing is frozen. All right. So there we go. We're going to do that. Maybe it's not cooperating. We're just going to see if it's going to let me draw any lines. It's not. So I want you to see that progesterone causes just about all of these things. Okay, now progesterone also, and I'm just going to put this here, decreases uterine contractions, which is good, and it decreases milk production. Okay, so when a woman's pregnant, she's not producing milk. She's not having uterine contractions. That's good. Okay, but progesterone causes a lot of other stuff. Okay, so progesterone causes this decrease in TPR. Progesterone causes this increase in ventilation. Okay, because we've got the vasodilation, that increases GFR. Progesterone decreases motility, which leads to constipation, increased GFR. All right, progesterone really kind of is the answer when it comes to pregnancy and specifically what's going on. Okay, and so hopefully you can see how these things all work together. Remember, progesterone as well as estrogen help maintain the uterus, right? So we're going to put that there. The estrogen helps with the breast size. Okay, it also helps do some other things as well. But just to see all of these systems are working together or are being affected together, right? And then just because we've talked about urine so much, just remember, not only is urine volume being affected by basically changes to the cardiovascular, the respiratory, the endocrine, and the digestive systems, but the fact that you've got a tiny, almost human in your body, that's going to squish your bladder. And so what's going to happen is women produce more urine volume, but they have to go to the bathroom more frequently because the size of the bladder is now a lot smaller. And so you're creating more volume, which means you're going to fill up a smaller container faster.